CCA Exam Questions Medical Coding Practice Test and Study Guide, 25 Essential Questions. Question 1. A 32-year-old woman in her 30th week of pregnancy has pre-existing hypertension. Code O10.013, Z3A.30, O10.919, I10, Z33.1, O13.3. O10.013 specifies pre-existing essential hypertension in the third trimester. Question 2. Which organization developed the HL7 Electronic Health Record Standards? AHIMA, Health Level 7, HL7, IEEE, CMS. HL7 is a standards development organization for health information. Question 3. Per CPT guidelines, what is a separate procedure, always coded with the main procedure, integral part of a larger service, never coded, always a modifier 51? A separate procedure is only coded if performed alone, otherwise, it's integral to the main service. Question 4. What is the principal diagnosis? The most expensive condition. The condition established after study to be chiefly responsible for admission. The reason the patient came to the ER. The last diagnosis on the chart. UD's definition of principal diagnosis. Question 5. Which modifier is used for a professional component only? Modifier 26, modifier TC, modifier 51, modifier 59. Modifier 26 indicates only the physician's interpretation and report. Question 6. In ICD-10 PCS, the first character 0 represents which section? Medical and surgical, obstetrics, imaging, placement. The 0 section is the largest, covering medical and surgical procedures. Question 7. What CPT code is used for repositioning a gastrostomy tube under fluoroscopy? 43,761, 76,000, 43,762, 49,450, 43,246. 43,761 for repositioning and 76,000 for fluoroscopic guidance. Question 8. Which coding system is used for physician office procedures? ICD-10 PCS, CPT, MSDRG, HCPCS Level III. CPT is the standard for outpatient/physician services. Question 9. What does NEC stand for in ICD-10 CM? Not elsewhere classified. No exact code. Not every condition. New entry code. NEC is used when the documentation is specific but the code set doesn't have a specific code. Question 10. A Z code in ICD-10 CM is used for symptoms, injuries, factors influencing health status, external causes. Z codes deal with reasons for encounters other than illness or injury. Question 11. Which CPT modifier is used for bilateral procedure? -50, -51, -59, -25. Modifier 50 is the bilateral modifier. Question 12. What is the purpose of NCCI edits? To increase reimbursement, to prevent improper unbundling of services, to code faster, to track physician hours. National Correct Coding Initiative, NCCI, prevents unbundling. Question 13. Which code range is found in the integumentary system of CPT? 10,000 to 19,999, 20,000 to 29,999, 30,000 to 39,999, 99,201 to 99,499. The 10,000 series covers the skin and subcutaneous tissue. Question 14. What does the seventh character in an ICD-10-CM injury code represent? Severity. Encounter type, example initial, subsequent. Location. Insurance status. The seventh character, A, D, S, identifies the encounter type. Question 15. Which CPT category contains evaluation and management codes? Category I, Category 2, Category 3, Category 4. E/M codes are part of Category I CPT codes. Question 16. A bundled code includes multiple independent procedures, the procedure and its related minor services, only the equipment, only the office visit. Bundling groups related services into one code. Question 17. What is upcoding? Coding for a higher level of service than performed, using a newer code, coding for a different patient, coding for a supply. Upcoding is fraudulent and involves misrepresenting the level of service. Question 18. In ICD-10-CM, what is the placeholder character? X0, 9, Z. The X is used as a placeholder to allow for future expansion and maintain code structure. Question 19. Which document is the primary source for coding a hospital visit? Billing statement, physician's progress notes/discharge summary, nursing flow sheet, lab results only. The physician's documentation is the legal basis for coding. Question 20. What does NOS mean in coding? Not otherwise specified, not on schedule, new outpatient service, number of services. NOS is the equivalent of unspecified.